What does a pharmacist do? Well, most people might answer that a pharmacist dispenses the medications that my doctor prescribes. Now, I work with a ton of great pharmacists, and one thing that I don't generally see is excitement about pills in a vial. And this is probably because pharmacists have been trained to do so much more. So what can you get excited about in your community? To find out, let's go beyond the scripts. Everyone, welcome back to Beyond the Scripts. I'm your host, Will Tuft with PioneerRx. And today, as usual, we have an amazing guest joining us this time from state of Colorado, Mr. Joseph Poling. Thanks for joining us.
Thanks for having me. Excited to be on.
Yeah, so relative newcomer in the industry, another one of the young guns out there making a big splash up in Colorado. So tell me a little bit about your journey to Good Day Pharmacy.
Yeah, you bet. So I've only worked for Good Day Pharmacy. I haven't worked for a chain pharmacy. I graduated from University of Wyoming, born and raised in Colorado, went up to Wyoming, knew I wanted to do independent pharmacy. And I met the owners at the time, Dave and Vicky, at an NCPA conference in pharmacy school. I had no idea what pharmacy was. I had no idea about Good Day Pharmacy, literally in the same town that I grew up in. And yeah, just knew that I wanted to do independent pharmacy and connected with those guys, Dave and Vicky, and got a job with them after graduating and been with them 12 years. And it's been a fun path to kind of see all the areas of pharmacy and specifically independent pharmacy. But yeah, I'm loving it.
Yeah. So shout to Dave and Vicky. Vicky was on episode 23 of the Catalyst Pharmacy podcast. So I got to talk to her a couple years ago, I guess. So it'll be fun to kind of touch base and see how things have changed in that time. But you said something kind of interesting. I didn't realize that you were actually from Loveland. And so there you have Good Day Pharmacy in your backyard and going to pharmacy school, and yet, still hadn't kind of made that connection, which I think is interesting because a lot of people that I talk to that aren't in pharmacy or don't have a professional tie to pharmacy, a lot of times just don't even realize what independent pharmacies are in their own community and what they can offer. I think a lot of times they may drive past that thinking that that's not a business that necessarily caters to their needs. Maybe that's like some specialized niche that they don't fit.
Yeah, 100%. It's silly that, I had no idea about Good Day Pharmacy. And I'm a huge advocate, or at least trying to help others that have pharmacies in bigger cities. Of course, if you're the only pharmacy in town or rural location, people know about you. And I don't know who said the quote. I like to steal quotes, but someone said people either don't like you or they don't know you. And I'm a little biased, of course, but I would choose to believe that most people in our area don't know of us. And even literally myself, growing up a mile north of the corporate office. So very true. So we're trying to get our name out there and trying to get more people aware of not just us, but all independent pharmacies that are, providing great quality service.
Yeah, I like that. Again, eternally optimistic outlook there that they either don't know you or they don't like you. And I think for most independent pharmacies, a lot of the population out there just doesn't know them. Just doesn't know that that's, an option. I know early, in my 20s, if I got a prescription for something, I drove past multiple independents on my way to what I recognized as pharmacy because, I kind of assumed that if I walked into an independent with, a antibiotic or whatever it was, that they would just kind of look at me funny, like, why are you here?
Yeah. Where do we get all those ideas from? I don't know. It's a mystery. And I think a lot of people think independent pharmacies are more expensive too. For that reason, like, oh, this is a small mom and pop shop. They only have unique things that I don't need. I need to go to the traditional, XYZ chain pharmacy. And yeah, so it's certainly not the case.
Yeah, I mean, there's definitely something to be said for marketing and visibility. And you can kind of take that to so many other areas. I know one of the kind of comical marketing things we see in my community. There are a couple like attorneys in the state of Louisiana that are like noted for their billboards, and it's kind of like an ongoing joke. They're so absurd, and there's so many of them, and so you're probably going to get much, much, much better service with a trusted local attorney who has an established practice in your community, but they just don't have that same visibility as the guy with all the crazy billboards. It's like, he's kind of a I don't know. I don't want to say a entertainment figure at this point, but definitely increased visibility. Yeah, even though he's definitely not going to be delivering the better service. Maybe, I don't know, and maybe I'm also biased. So you go to Wyoming, which is a little ways away, I guess. While you're in school there, one of the things I found out about you was that you were actually part of the 2012 group that was one of the 10 finalists for the, was it the 2010 Good Neighbor Pharmacy, the business plan competition. So it seems like early on you kind of had that entrepreneurial mindset. Tell me a little bit about that.
Yeah, no, I'm scared what else you're going to dig up and share on the podcast. Yeah, no, it was fun. So being an NCPA, of course, it's all about independent pharmacy, local pharmacy. And yeah, and I love working with others and collaborating with others. And I love ideas. And I just love new and change and shiny. Ooh, that's shiny. And so with the business plan, there were 4 of us, and we just were like, oh my gosh, in Laramie, University of Wyoming, where the school is, it's like there's no good acute care type setting for students or residents that live here. And it's like you go to the ER or you go to, these doctors' offices that are busy. So kind of like today's world too. And so we're like, man, we should, come up with this idea to have a acute care type pharmacy. And so we put together a business plan. It was a lot of fun, learned a lot. It's hilarious looking back. I still have it saved, the PDF. I'm like, oh my gosh, we had no idea what we were doing. And we missed so many huge things. And so I'm amazed that we were top 10. But yeah, a few years later, then sure enough, someone implements that plan, and there's an acute care type pharmacy setting in Laramie now. So kind of fun to see. It's like, okay, our idea was okay because someone ran with it. But yeah, it was fun just being involved with NCPA, knowing that I wanted to do independent pharmacy, just tried to learn and absorb as much as I could. So tried to get involved.
Nice. So coming out of school, you go back home to Loveland area. One of my favorite places in the whole country. That is just such an amazing part of the country. Did you always kind of have that in mind? Like, I want to go kind of back home, I want to stay local, or did you want to travel abroad? Were you tempted to go, try it out in another area?
I had an opportunity to move up to Montana. I had a job offer up there, and Dave and Vicky will laugh because they were dragging their feet on me a little bit. So I almost did that. They couldn't make an offer for me, but they did in time, and the rest is history. So yeah, I always wanted to be local. I just, maybe not necessarily live in Loveland still, but yeah, I like community. I like building relationships. I like, I liked the thought of, working in the town that I grew up in and seeing my high school teachers and, just college friends that were, in the area, high school friends. And so no plans to go abroad or anything crazy like that though.
Nice. So you come back home and you start on as a staff pharmacist. Are you playing soccer at that time? Still playing a lot of soccer?
Oh, heck yeah. Gotta avoid the dad bod. The dad bod, the fight is real. The struggle is real. So yeah, play soccer. Yeah, it's fun way to burn off some stress. I try to play, not as fast as I once was, but yeah, still played soccer for sure. Which we have. So in Windsor, I live in Windsor. There's a complex called Future Legends. I don't know if you've heard of it, but apparently it's the second, either the largest or the second largest indoor dome in the country. And so there's indoor soccer fields, volleyball, basketball. It's like right there in Windsor. It's like we're the second largest in the country. So anyways, I play soccer there, and we play a little outdoor soccer too. So.
Yeah, we need something like that here. I'm like right kind of between on the state line of Texas and Louisiana, and it is unbearably hot. We need some kind of dome just for protection to go outside.
Go from AC to AC. Yeah, exactly.
Yeah. So you started on 2012? You said at Good Day. So what did that look like early on, and how did you transition into a leadership role from a young staff pharmacist?
Yeah, great question. So started in 2012, had no idea what I was doing. It's fun to look back. Always measure backwards because it makes you feel really good. So yeah, I was a float pharmacist working at multiple locations, kind of learning what worked, what I liked, what I didn't like, what I saw from other team members and pharmacists. And so I'd floated for about, I think 5 or 6 months, and an opportunity became available to manage our flagship location in Loveland, which was compounding at the time. We did hospice, a ton of deliveries, kind of a little bit of everything. And the first 6 months, I was just all about learning and helping and trying to make it easier for those that I worked with. And so it was fun to hear feedback from some of the teams, like, oh man, yeah, you're here today. Like, awesome. We like having you, kind of thing. Just work hard and help people. It's very easy. It was, I guess, maybe natural for me because, again, I just love to help people and help the teams, certainly helping customers too. But I think my path to leadership was helping the internal, colleagues that I had and team members that I had. And started managing at Loveland in early 2013. Again, just learning, figuring out what I needed to know and needed to learn. Just ultimately tried to make things better. I could easily become a workaholic, so there might have been some of that too, staying late, going in early, staying late, not always good on, marriage, relationships, things like that. So I've learned over the years to put barriers or, limitations. It's like, all right, I got to step away from work. But yeah, just put in a lot of effort and time, and wanted to help my team members internally have an easier job and a less stressful job. And then for customers and patients, I just love, again, connecting with people. I had my first job growing up, or one of my main jobs that I had for about 6 years, was Cold Stone Creamery. So that was the best job to teach me customer service, and every single customer coming in through the door, hey, how's it going? And the people that I worked with are amazing and super fun, and we were singing and dancing and crazy. And Cold Stone is not what it once was. When we go to Cold Stone and tip now, I'm like, you have to sing and dance for me. And I sing along with them, but so yeah, that taught me a ton about customer service. So shout out Cold Stone. Great ice cream too.
I think any of those service jobs, food service especially, is such a great, just growth experience and study in psychology and sociology.
Totally. Yeah. And so putting that into pharmacy world, just engaging with customers at Cold Stone, it's like, yeah, do the same thing at Good Day Pharmacy and just, hey, how's it going? So I was just friendly, and I tried to know people's names, of course, which most independent pharmacies do. And that goes a long way. That's, of course, our favorite word is our own name, when we hear someone say our name. So Will, it feels good. And so, did a lot of that early on. So helped the team members, and then just tried to make customers' days better and just be friendly and listen and also just try to be fast and kind of do everything, which everyone knows in pharmacy, you got to multitask like no other. So anyways, yeah.
Nice. So for anyone that's not familiar with Good Day Pharmacy, currently you guys have what, 8 locations and a long-term care?
10 community locations, 1
Okay.
central fill, and then 1 long-term care. So 12 Good Day pharmacies.
And what was that like in 2013? Similar number, maybe?
Let's see. I think we had 2. So we did not have our central fill, and then we recently acquired a sterile compounding pharmacy, so that was new. So yeah, similar number. We're not about growing in number of locations. We want to get better before we get bigger, and that's stealing from Chick-fil-A. I mentioned I steal a lot of quotes. So yeah, very similar structure in 2013, similar location number.
Nice. Yeah, so if you look at a map of Colorado, there's, quite a few little dots on the map for Good Day, but they are still relatively close by. So it is neat that you have that kind of, geographic footprint.
Yeah, and it's amazing that so many people still don't know of us. So it is so important to get your name out there. And of course, we've been focused on 5-star reviews. That's been helping a ton. And now is the best time to transfer in patients to independent pharmacies, because the experience at chain pharmacies is not where it needs to be, and we all know that and see that, and they're closing, and the teams meet, they're great people that work there, and they mean well, and they're doing their best. And yeah, there's just a high demand on them, and it's stressful, and they're burnt out. And it's like, that's what most of Americans experience, including, policymakers. And so it's like, what is happening to pharmacy? And so now is the best time to transfer those patients over. So yeah, getting your word out, getting your name out there. And, we've been doing a lot of geofencing recently. That seems to be working pretty well for us. And then 5-star reviews, like I said, people are looking elsewhere. And yeah, so even though we have a lot of dots, and again, we don't care that we have a lot of dots, we just want to make a difference. But, a lot of people still don't know of us. So we're just, always open to try new things marketing wise.
Yeah. Yeah, no, but those dots definitely kind of grow into, a network adequacy across your community. So it is cool to have that blanket. And then it's a good point that you said too, the awareness just that comes with 5-star reviews, because anymore, like if you're looking for something, the first thing you do is open your phone and, open an app, whether it's, a Maps application or just, Google search. But definitely that testimonial from a customer who's, relatable, definitely is going to make all the difference in the world. That means so much more to have that organic feedback than a radio spot even, which is great, but anything that feels honest like that from a peers is always, that social feedback so valuable.
Yeah, yep, agreed. Yeah, I would encourage anyone listening to text through Pioneer, which is so easy. Just have, a copy and paste snippet and, hey, love our service, leave a 5-star review and link your Google review. And you could certainly do that with Yelp too, but that's the best way and easiest way. It's like, oh my gosh, I just, found this product for that patient, or they were like, oh my gosh, I love you guys. Always text those patients right then and there to get 5-star reviews, and tell them like, hey, we'd love a 5-star review. It helps us. They'll do it. You always ask for what you want. And so I would encourage everyone to do that. And whoever is managing that and seeing that, on Google Business Profile or Yelp, share that with your team, because that's another thing. We have a Slack channel, and all of our teams see every single 5-star review. We hide the 1-star reviews, so they don't see that. We follow up on those internally. But all the 5-star reviews, it's kind of like, like, man, you guys were awesome. And so everyone can kind of, high five and little camaraderie. So anyways.
Yeah, no, I love that. And, one of the things that I'm going to 5-star review on is not necessarily the ice cream that I got at Cold Stone, because ice cream is, always kind of ice cream. But you're definitely, going to have that icebreaker, that success is really on that interaction with the person. That's what's going to push it over the edge and make me want to go, make sure that I leave a compliment.
Yeah, 100%. Yeah.
So you mentioned the geofencing, and that's something we hear people kind of throw out there that you should do. Can you talk a little bit about how you guys are doing that? Are you targeting, specific kind of genres of businesses, or, what are you looking at when you're making those decisions? And then what kind of platform are you using?
Yeah, you bet. So we have a marketing specialist. Her name's Katie. She's awesome. So shout out Katie if you listen to this. She is currently using a couple different platforms. We work with a local gal that does some geofencing, and then we have it's called Ground Truth, and that's a platform that you can kind of learn geofencing on your own. So she's kind of teaching herself a little bit, just working with the local gal, and then Ground Truth. And so the businesses that we like to target are certainly the high foot traffic chain pharmacies in our area. So the top 3 chain pharmacies that are nearby. So we geofence those because, of course, tons of foot traffic. And then, if our Longmont location, for example, they're right by an Ace Hardware. It's like, okay, we know there's a ton of people walking in there that probably have no idea that Good Day Pharmacy is right across the street, even though we think it's so obvious, and we're not out there yet standing and dancing on the street corners. But so high foot traffic businesses nearby are in the same parking lot, and the chain pharmacies. And then, you can get more specific, of course, and like, hey, we want to target more work comp claims. So, okay, let's target some work comp provider offices, or, hospitals. Like, hey, we want to do all the discharge, transitions of care. Let's, geofence the hospital. It gets a little tricky. And there's a new thing that we're learning that we haven't really done anything yet with, but there's geofencing, and then there's oh gosh, now I'm drawing a blank. Geo leveling. So you could geofence specific levels within a building. So it's like, hey, I want all of the new moms on the birthing unit to rent breast pumps from us. So let's geofence just that level of the floor within that, 10-story hospital building.
Wow, how cool is that?
Yeah, it's kind of creepy, Big Brother's watching all of us all over. But so anyways, geofencing's been fun. And of course, the point of geofencing, for anyone that might, not fully understand, you are converting. So you're selecting a geographical area on a map that you put a perimeter around. So then anyone that enters that area is going to, at some point later that day or later in the week, see an ad on their desktop or mobile phone with whatever messaging you want them to see. And then these companies can measure, or they can assess if that person had not entered your building. So they entered the geofenced area, so Walgreens, and then after seeing your ad somewhere on their mobile device or desktop, then after that, then they physically come into your location. So it's called a geoconversion. And there's click-through rates, and so we're learning. And Katie's doing an awesome job.
Nice. Have you guys had any success with like targeting other businesses? Maybe, a health food store. If somebody's paying a premium for, healthy choices, would that make them, an ideal candidate for, functional medicine or something, kind of outside of the traditional prescriber offices?
Well, that's a great idea. We're going to start that next week. No. We're always trying to add it, do more and more. So no, we haven't done anything like that, but absolutely, you can get super creative. And again, there's so many ways to geofence and target and market, and it just depends on what your business is trying to do and what type of niche products, compounds. We've started to geofence areas that we think patients might be more open to compounding. Hey, need personalized medicine. So certain demographic populations like that, or
Sure.
Really good patients. Yeah. So of course, so we're kind of at the tip of the iceberg. I feel like more and more marketing is digital, which is not news to anybody. And so just trying to stay up with the latest trends.
Yeah. So you're not out dancing in the street yet, but you may be able to find some dance moves on TikTok.
Yes.
I found I actually saved like a screenshot of it so I wouldn't forget to mention, but and some like bright orange shoes where you're kind of showcasing some soccer footwork, I think.
Those shoes make me move faster. Yeah. Please don't release those TikTok videos. No.
Yeah, quick search for Good Day Pharmacy on TikTok, and you'll find some really fun TikToks where you are just kind of reaching out to your local base with an organic connection where you're talking to the actual customer base, which I think is really fun in a way that is both entertaining and informative, which is such a hard line to kind of straddle because you have to kind of make it worth watching, and if you can bring some professional benefit to it at the same time, that's really the secret sauce. So tell me a little bit about the TikTok.
Yeah, you bet. It's fun. Katie was like, "Hey, you're gonna be our TikTok person." I was like, "If I have to, I." So yeah, she's like, "Hey, these dance videos are trending, or this XYZ is trending," and we haven't been super consistent with it yet. So there's a few videos, and then we kind of drop off. But yeah, we're just trying to reach the younger demographic. Typically they're not on a lot of prescription meds, but to your point about functional medicine or just even over-the-counter sales, it's like these are customers too. And if we can, again, get our name out there and let people know about us and just be a resource for people, like, hey, we're here. Even if we're not promoting Good Day Pharmacy, I try to say like, hey, just check out your independent pharmacy. Like they're going to serve you better, and probably give you a better experience. So kind of doing it for fun a little bit. And just to promote independent pharmacy in general. Yeah.
Yeah. So you're definitely able to kind of promote some of the services that you guys offer. And if you can get somebody over to the Good Day Pharmacy website from TikTok, then they can find quite a few services that you guys offer. So I did want to talk a little bit about some of those. One of the services that you guys offered that I thought was pretty interesting was the OTC offerings that you guys have with a published list at $249 a month for most quantities, which is a much lower price than a customer is going to find for any of these OTC items, shopping retail for any of these items. So I thought it was pretty interesting that you have that published list and how that has been received. And then how does that actually work at the pharmacy level? Is that something you're buying in bulk? Are you selling these as white labeled or how do these OTC items work?
Yeah, that's a really good question. I'm glad you brought that up. So that is actually for our long-term care residents. So we probably need to make that a little bit more clear. So
sure,
come into our community pharmacies but yeah, we offer that to all of our long-term care residents, and of course their POAs and caregivers, things like that, to just make it affordable, because it's long-term care residents, their family members are buying big stock bottles at Costco and King Supers, Walmart, wherever, and bringing it in, and there's just a ton of logistical challenges with that for the staff at those long-term care communities. And so it's like, hey, let's just do this. It's basically break even for the most part. It's safer, we can blister card it so that way residents, stay compliant, and it's easy for the nursing staff and things like that. Yeah, so nothing on the community side. We have, aggressive pricing with our retail OTC
Gotcha.
offering just to compete against, everybody else kind of thing.
Yeah, what a great offering in the LTC space, though, because like you said, the fish oil, you can imagine having those giant containers for so many different patients, and those OTC items that maybe wouldn't be included in those blister packs. It's a great idea to have those offerings in that format. One of the things that I thought was really cool too is that you guys have so many different resources on the website just to find out about the services and even compare the value of other pharmacies, other pharmacy offerings to the Good Day Pharmacy offerings. And I thought that was a really cool kind of breakdown that you guys have, the true value comparison chart. And then just information on your diabetes training, on your MedSync program, and how you can sign up for the adherence packaging online. Just a lot of resources, a lot of, really great visibility right there on the website.
Thanks. Yeah. Yeah. We're trying. Yeah. And like most independents, you offer a ton of stuff and things that you think make a difference. And I'm most proud of our day pack programs. That's what we call our adherence packs, the strip packaging. Our teams are just phenomenal. I mean, the level of care that those patients receive that are on that day pack program is just crazy. With dose changes, duplications, patients wanting certain meds in the pack and not in the pack, like we have some Slack channels and teams work together, and there's just a lot of collaboration. And it's like MedSync is great, and MedSync is awesome for, of course, us, the doctor, and the patient. But that day packs is like next level, where you're just totally helping that patient manage their meds, empower them, make sure everything is correct in there, what time of day you're taking it. And it's wild to, as a pharmacist, to check a prescription and, hey, take 1 tablet by mouth nightly. And the patient's like, no, I take this every morning. I want it in the 8 a.m. slot. You're like, wait, no, you need to be taking that at night because it's working out overnight, or, so it just opens up a lot of opportunity to engage with patients and make a difference. And sometimes the dosing doesn't matter, but sometimes it does. And when they tell you when they're taking it, that is so, so valuable. So if anyone's, contemplating offering a adherence program, or a strip packaging program, or Dispill, or even just manual blister cards, you're going to get a lot more information from your customers, and it's going to be valuable to you, and then therefore valuable to them.
Yeah. And so, of course, you have to have that MedSync kind of in place to be able to move into that adherence packaging space. Are you including your OTC offerings in that adherence packaging as well?
Yes. Yeah. Of course. Yeah. If they want to add OTC supplements, anything, we absolutely add it into the either sync or into the day pack program, which is nice. In Pioneer, you can add those, onto the patient's profile. So even though it's not a prescription, it's like, hey, add that in there. So then you can do sync prep message and, make sure those patients continue to reorder things that they want and things that they need, and get it synced up and get it packed up as well.
Yeah. Yeah. That's another part of the challenge, is once you get a program implemented, is continuing to implement and make sure it's executed, whether that's, a patient's initial med sync and keeping all of those drugs synced. But then when you have a discussion about those nutrient depletions, or why they should be taking a multivitamin, or whatever they're taking over the counter, to make sure that it's not a one-time sale, and to make sure that they're continuing that month after month. So yeah, including that in your sync, so important. It's interesting that these are things that I feel like most independent pharmacies are, implementing in their pharmacy and trying to keep moving in a single location. And there's a lot of moving parts that, even in a single location, it can be hard to operationalize and keep that going month after month without losing focus or something else, moving higher on the importance list. So, kind of a two-part question, I guess. When you do introduce programs like adding OTC to their adherence packaging, if you weren't doing it before, and how do you kind of operationalize that on a single location, and then, a step higher, I guess, and maybe that higher step of thinking about multiple locations being able to follow the same process. Do you think that maybe that gives you a more clear vision of how to execute at the individual level, because you have to zoom out a little bit further?
Yeah. No, all really good questions. And first off, hats off to those single store operator owners. Like, holy cow, you are wearing so many hats. And to your point, they're getting pulled in a million directions. And so I like to encourage people. So anyone listening that's operating a single store, like, man, keep doing what you're doing. It's making a difference. Lean on your network of colleagues to help. And, I think that's why independent pharmacies can thrive too, is working with each other. A little healthy competition, is a good thing. Independents at times can kind of compete on the same turf. But there's always plenty of business to pull from chain pharmacies. So if you can lean on others in your area, whether it's a GPO or, your state pharmacist society, lean into those people. But so in terms of implementing something, we because we have a lot of locations and we're blessed to have a ton of locations. And I just get to sit back here in the office and the teams just take care of everything, man. The teams just think I'm getting massages here. No. But it starts with hiring the right people. So if you have the right people, then to pull from atomic habits, right? We don't rise to the level of our goals. We fall to the level of our systems. So that's, just such a popular quote, and it's so, so true. So even if you have a great goal, it's like, you need a good system. And more importantly, you need the right people. The right people can take a terrible system and make it great. But if you have the wrong people, even a great system and a great process is not going to work. So it starts with evaluating your team and evaluating who's going to take on this new project or new initiative, or who is going to launch MedSync. Because we should have done MedSync 10 years ago, but hey, let's better start now, better late than never kind of thing. So the way we like to kind of roll out initiatives and new operational, projects is start with one location. Let's start with a location where it makes sense for that patient group. This is a need of the patients in Greeley, and so let's start with Greeley. Or, hey, this technician is very, very passionate about this. Man, let's give them the project. So we like to think who before how. So instead of how, who. Start with who, and identify who's going to just be excited about it and passionate about it, and who's gifted at doing that project. Start with one location, kind of tweak it, adjust your Pioneer settings. Like, how do you actually integrate this into workflow? And just from a big picture, like when we're looking at all of our locations and trying to roll out something across the organization, it has to be a win for 3 categories. So it has to be a win for the patient, which is obvious, right? Like the patient has to benefit from this. It has to be a win for the business, economically. Like, does this make sense financially? Is this beneficial? Is this going to be sustainable? And then lastly, what I would consider a success is it has to be a win for the team. What you are trying to do, if you can make it easier for the team, if doing XYZ or implementing sync ultimately leads to the team having less stress, or it be easy for the team, or hey, they're going to just want to do this because it's less work for them. Those 3 things, a win for the patient, team, and business, like that's the sweet spot. And so with MedSync specifically, of course, it's hard to get off the ground. Starting is always the hardest part. But if you can get the who to empower the team and champion the process, awesome. And then in terms of, even for us specifically, MedSync to day packs, it's like, oh my gosh, that sounds hard. Like, how is that easier for the team? So because we've central filled it.
Yeah. So should probably dive into that with a little bit of explanation for anybody who does not have a central fill. Good Day has actually implemented a really amazing central fill kind of workflow that I know you've worked with, a lot of the PioneerRx team and some other partners. So it's a really impressive central fill model that obviously not everyone is going to be able to emulate in their community. But again, I think once you kind of operationalize that process, you can start to have those same benefits, even, on a smaller scale or a different scale. But I think it's interesting you started with finding the right person, because I'm always curious. Every trade show I go to, when I sit through as many CEs as I can, and there's so many people asking great questions and taking notes and getting excited about a new idea. And you wonder how often those are going to be implemented, because there's always more great ideas than there is time to implement. But creating that champion at store level seems like a great way to both delegate and give your team ownership and something to be excited about. Like there's so many positives that can kind of come from that initial, from that being the step one.
Yeah, agree. In MedSync, to give credit where credit's due, Stacy, a technician of ours, she went to a Pioneer Connect conference years ago and learned about sync, and she became our sync champion. And from there, it grew and spread across all of our teams. And so, yeah, if you send the right people to the conference or you have them attend certain training, if you empower the team, they love it, because it's like, sweet, like I have purpose now. What I'm doing, I'm working on this new project. It's challenging me. I'm learning. I'm developing. Growing as a leader. And it certainly doesn't need to be a pharmacy manager. It doesn't need to be someone with a leader title. So yeah, our technicians are just phenomenal, and sending people to their, exposing them to things that we think they might be interested in. Just their eyes open, and from there it's like, all right, I'm out of your way now. That's what I was joking about earlier. It's like all I do is just identify people to take on things that I think they'll be really good at, and give them the tools to be successful, and then just get out of their way. And hey, how can I support and help along the way? So that's our model, or at least mine.
Yeah. So as the operations officer there, you have the responsibility to make sure that it leaves that, that ownership or grows from that one person who's passionate about it into a format that's scalable. And I feel like that is an opportunity for a pitfall at a lot of independent pharmacies where, if somebody owns a process, sometimes it can be problematic to the point of, that person is sick this week. And so we didn't have that process, really grow outside of that person's role. So how do you go about making that new process with that champion and building that into a scalable model that's transferable and kind of bulletproof that plan of action?
Yeah, you bet. Great question. And we're still learning and figuring things out. We're certainly not perfect, but yeah, if you identify a champion to take on that new project, of course you want them teaching, coaching, empowering others underneath them, or cross training. If you have a lead tech and like, oh my gosh, they have the burden all on their shoulders. When that person is gone, this week is going to be chaos, and so no one wants that. And we've learned too, it's those that are passionate and want to do a good job, they take that burden and that weight on their shoulders themselves. And so we love one-on-ones. So the manager at every location, just connecting one-on-one with each team member, like, hey, like, how are you doing? Like, do you have the right amount of work? Do you have the right amount of support? Do we need to have someone kind of co-share the burden with you? And who do you think that is? And so just asking a lot of questions, having a one-on-one. And so if it's a team of two, which we have one pharmacist, one tech, it is a lot. And those two people are doing a lot and they're wearing every hat, and it is hard. And it's just the reality, when one of them's gone, it's not going to be as smooth and efficient. As you can grow and kind of bring new team members in as the business grows and as revenue grows, then of course you can start to kind of dilute that burden and share the burden. But yeah, big on cross training, big on, just our teams all being a resource to each other, just helping each other. Hey, we were short this week because of Pioneer. We can workload balance, and we're geographically close, and so we can do data entry for other locations that might be understaffed. And so obviously, there's not everyone's in our situation. Again, we're grateful and blessed, but yeah, if you're one location, just deciding what is most important and what is most effective. You can't do everything, and if you try to do everything, it's, everyone is going to get burnt out. So choosing what's most important and identifying who can kind of carry, kind of spread the load, if you will.
Sure. So as you've kind of grown all these services, you guys are definitely offering quite a few different services to your patients. How do you fit those into that model? Are you kind of moving into like the appointment-based model? Do you really have a lot of requirements during your sync call that your team is following to make sure that they're delivering those opportunities? Or are you following up with kind of text or mail outs? Like, how do you keep the patient informed enough to take advantage of those opportunities and those services, and make sure that your team's kind of in the loop with follow up?
Yeah, we don't do any of that well. No. So yeah, great question. It's tough. Yeah. We do all the traditional stuff to keep patients informed, the little bag stuffers, and what's our wildly important goal or wildly important focus this month. What do we want to be focused on? And because, with flu season around the corner, it's like, okay, all this other stuff is probably just going to go on the back burner. And now we're going to start talking about vaccines, flu, pneumonia, Shingrix, Tdap, COVID, TBD, and then open enrollment. So you got to be focused and choose what you want to inform the customer about. And then if they want to know more and learn about other resources, like then, a website or something that you can point them to, like, hey, if that was great, if you liked your vaccine, if you had a good experience, like, hey, check us out. There's a lot of other stuff we can do, And so little just touch points at the counter. Hey, if you know somebody that would benefit from this, if you have, materials near your point of sale, it's all about the relationship. If you know the customer and you know what their needs are, then you can tailor all the different services that you have to that specific person versus like, we want to market everything to everyone. That doesn't work. And everyone knows that. So getting to know your customer, asking the right questions, and then just giving them what you think would benefit them.
Nice. So a couple of years ago when Vicky was on, it was kind of in the middle of COVID, immunizations were still, just taking everybody's time. And she had a great comment where she was like, I don't even remember what we were doing before COVID because it was so crazy during that time period. So for most pharmacies, I feel like now we've kind of gotten back into a new normal, or whatever normal it is. So with that kind of return, have you seen any long-term changes that came from the COVID-19 era? Or were there things that you were really excited to implement once things kind of got back to a little bit of normality? What is business like post-COVID?
Yeah, it's much better. Yeah, still busy as ever, as everyone would agree with. We like that appointment model. I think that was a big shift and a helpful one to be more proactive. So we certainly still do appointments for all of our vaccines. We do appointments for point of care testing, appointments for consultations. We've put everything on, a digital format or electronic format because so many people are on their phones and, on screens, and now everything's, ordering online. So it's like, all right, let's make sure all of our resources and transfer in form, that's probably been the easiest thing to transfer patients in, is just instead of taking a phone call and spending 5 minutes, writing down every medication that they need transferred, just point them to your website, fill out the form. It comes right to us. We'll take it from there. We'll follow up. So trying to, just continue with that momentum because people are used to, paying online now, paying ahead. I know Pioneer is a couple days away from the payment facilitation process.
the click to pay still a couple days out. Yep.
People like technology. They're used to it now. Let them use it. Let them engage with you as they like to. And maybe that's in the middle of the night. They're not going to call your pharmacy in the middle of the night to transfer, but they're going to use your transfer in page, or they're going to sign up for an appointment. And then, of course, because pharmacy in general, just again, commending all of pharmacy and all of the listeners, man, pharmacy stepped up a ton, during COVID, and let's keep that momentum going and continue to be the most accessible healthcare provider, and pharmacy techs too, pharmacists and pharmacy techs, but most accessible, most impactful, especially in a critical situation and public health emergency. But yeah, so we're trying to, I guess that's maybe a shift we've taken, is being more proactive legislatively, and how do we continue that momentum to be reimbursed appropriately and provider status and all those good things. So we're in that fight with the rest of the group too.
Yeah. Yeah, no, that was a great point about just the, consumers' kind of comfort level with technology. If you asked me to scan a QR code to view the menu before COVID, I would be like, well, this is very novel. And now it's just the way it's done in a lot of places. So I love that your website has those forms that you can actually fill out online and get that, get pharmacy to reach out to you. I mean, personally, I've been putting off for like a month. I know I need to get in for an annual visit with my general physician, and during business hours, I'm not thinking about it. It's when you can relax after hours, and you're worried about your personal life that you think about those, and okay, yet again tomorrow.
Yeah, absolutely. Yeah.
So legislation and advocacy, always super important. So anything exciting going on in Colorado these days?
Colorado's got a lot of good things going for it. Pharmacists can do a lot. We can prescribe in various categories that a lot of states can't. And I just learned yesterday that some states still don't allow their pharmacists to vaccinate. It's like, oh my gosh, like that is so unfortunate. And so, again, how can we kind of pull together and just move pharmacy as a whole forward? We've met with some local staffers, for some House of Representatives, and just educated them on, PBM transparency and provider status and things like that. And it's crazy when you start to describe what is happening to just all of pharmacy, and specifically independent pharmacy. It's like, they are just mind blown when you talk about DIR fees, when you talk about underwater claims, and like, yeah, like, do you know of any other business that loses money to sell you something? And, you don't go into a store and expect that store to lose money to sell you something or provide a service. And so, because, again, circling back to how bad pharmacy experience across the country is in general, because most people are using chain pharmacy, now is a great time to talk about how independent pharmacies can be different. And hey, we have Sync, we have day packs, we have, all these niche products in the front end that are probably higher quality, and all these services that we can do. And of course, chain pharmacies are trying to do all those services too, but do you want to wait in line for 2 hours, or do you want to show up and the store be closed? And so, when you talk to these individuals, they're definitely open, because they're like, yeah, I just was at pharmacy such and such, and they were closed, or now was the 5th time I went back after them texting me it was ready and it's still not ready. And so again, great time to transfer patients in, and a great time to talk to policymakers.
Yeah. Recently we had Kevin Duane from Panama Pharmacy down in Florida join us, and back on May 23rd, he was at the hearing for the third-party prescription drug programs, and it was a really, really great meeting to watch on C-SPAN, and Buddy Carter had some great lines there, and it was a really fun article that the testimony that Kevin Duane delivered. So I think we actually linked that in his episode too. So you're right. When those representatives hear the firsthand stories, they are often shocked and appalled.
Yeah. Oh, for sure. Yep. And it's like, man, all these rural community pharmacies, like, how are they supposed to survive? And then how is that a good thing to, only allow mail order, or only allow, something that's not going to work for a local community? It's like, man, we got to, encourage, or there's got to be some changes to make it sustainable for independent pharmacies, especially those in rural communities, for the patients they serve.
Yeah. So a lot of changes they're underway, a lot of legislation out there. The DIR apocalypse is looming and moving to the point of sale. Maybe you've heard of it. So 2024 seems promising. It seems like there's definitely a momentum and there's definitely some awareness. So what else do you see for 2024 as we're kind of working towards the fourth quarter of the year?
Yeah, definitely a big government bailout to pharmacy, Will. Yeah, I'm optimistic in my team. I don't have rose-colored glasses on, but there's opportunity. I'm optimistic. We're still finding ways to win. Others are still finding ways to win. And so we are shifting as we head into Q4 to more front end. It's very natural and easy to just be so focused behind the counter and, workflow optimization and getting out as many scripts as possible and inventory and ordering and sync and all those good things, which absolutely has to be done. We're just trying to educate and empower our teams to be more focused on the front. And truthfully, it's a win-win. If we can get customers coming in and, they transfer in, they're on 10 meds. All right, let's get you on sync. So that way you take all the meds that you need to be taking. And then let's start to talk about are these meds working? Do you need to be on all these meds? Are there things that you can do differently to, and for us to de-prescribe or work with your provider to take you off some of these meds and shift you to a service, a class, a supplement, something that's probably going to be better long-term for the customer, and more sustainable for the pharmacy. It's man, if we can just sell supplements and, help that patient with lifestyle modifications and coach them and have them in a DPP class or something, that's a win for everybody. And that's more exciting for a pharmacy team too. People like to, especially those Gen Zs out there, like to buy into a mission and, work for a company that's making a difference. And so if you can provide that structure for them, man, help these patients. You have a role, you're empowered to take care of these people and they're your patients. And so that's what we're kind of shifting towards in Q4. And then certainly in 2024, Whitney Osborne's one of our pharmacists, and she's our director of pharmacy operations. And she's very focused on clinical work and getting certain grants and just building relationships with local organizations. And she's got a ton of good ideas on how to help our teams provide services that pharmacists can do and pharmacy technicians can do that are on the clinical side. So of course, everyone's talking clinical and what can you do, point of care testing, things like that. And yeah, there's ways to win and ways to shift away from PBM and away from DIR fees.
Yeah, I love that. And, there's so many names for it and classifications for it, whether it's functional medicine or, clinical interventions. And, there's lots of fun ways to, kind of label that. But really, I think you touched on the deeper personal skill. There's kind of selling that mission or that purpose, having that purpose. Even companies that sell products like Apple don't necessarily sell products. They sell that bigger mission really well. I know Simon Sinek loves talking about their why is, they sell lifestyle products that happen to be electronics. And having that same kind of approach, from a business angle definitely makes sense, but it's definitely a better way to spend your day, making a difference, having a purpose. So if you can combine those two, that sounds like a really winning combination.
Absolutely. Yeah. Yep.
All right. So coming up at the hour, I'm going to let you go ahead and get back to it. I know you've got lots going on there in Loveland. So thanks so much for joining us, and can't wait to catch up with you soon and see what's changed over the next 2024.
Yeah, thanks, Will. Thanks for having me. It was fun. Keep doing the good work that you're doing, and looking forward to listening to future podcasts.
Thank you for listening to this episode of Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow PioneerRx on your preferred social media platform.